Good morning, everyone. Thank you, Sophia, Bim, and Nora, for making the time in your busy morning to have a quick chat about 20-year-old Ruby. She came to the emergency department last night because of deterioration for her mental health, and her friends and family are concerned about her. I just want to dive a little bit deeper and discuss if we need to make a referral to the clinical nurse consultant to conduct a mental health assessment. I will get us started by discussing young people and mental health and the importance of using integrated care and taking a recommendation from Headspace in regards to Ruby's care. Using integrated care for young people with mental health holds some really core values, including holistic care, continuous care, collaborative care, and shared responsibility. We have evidence that suggests that this is the best method for Ruby and young people with mental illness. Having a holistic approach really puts Ruby at the centre, and we can aim to look at her life and the factors that have affected her directly as an individual, including her social, biomedical, physical, socioeconomic, psychological, emotional, and spiritual well-being. Whilst looking at her factors holistically, Ruby's life will forever be changing, which is why continuous care is such an important value in the integrated care structure. Some of these issues that we are looking at today include Ruby moving back to Sydney, losing her job or feeling unmotivated to start university, might not be relevant or overwhelming to Ruby in a few months' time. It's vital we stay up to date with Ruby's life situation to see what she needs assistance or support with and how we can provide her with healthy coping mechanisms that are relevant to her life at this current time. Collaborative care is important because it keeps us as professionals who are caring for Ruby to work cohesively together to look at her well-being and agree on the best course of action or treatment plan, whilst taking her and her family's thoughts and feelings into consideration. With collaborative care, good discussion and considerations are contemplated by multiple healthcare professionals, and then Ruby and her family can then decide on the information provided to them and make an informed decision. Lastly, shared responsibility is a joint effort from everyone involved, including family members, healthcare workers, and support workers who cross paths with Ruby. This includes keeping shared goals and actions across Ruby's recovery and keeping people accountable for their own actions to achieve a desired outcome for Ruby. For example, we are all here today aiming to get Ruby help and back on the right track to keep enjoying her life, and by putting desired outcomes in place. Sophia, are you able to share your thoughts on Ruby and how we can assist her further?
Thank you, Natasha. I strongly believed Ruby will benefit from the CHIME recovery model, which is widely used in mental health recovery. The framework stands for connectedness, hope and optimism, identity, meaning in life, and empowerment. Because of the strained relationship Ruby has with her friend Alicia and her sudden move from her life in Melbourne to Sydney, Ruby will need to build strong positive social connections in her new location. This can be achieved by introducing her to peer support group to help her feel connected. Also, her current anxiety and panic and also suicidal ideation indicates a loss of hope. Recovery can be achieved for Ruby by instilling hope through small wins, by shifting focus from long term goals like going to the university to highly achievable daily goals like getting out of bed, daily hygiene. This will help rebuild Ruby's confidence. In addition, Ruby has made statements like, I'm too good for my job. This suggests a defense mechanism masking a sudden drop in self worth, self esteem, and identity. Her poor hygiene also indicates a disconnection from her usual self. Ruby needs help understanding that her recent behavior is because of mental distress and it does not define who she is. Ruby will need help to focus on her strength and resilience. This will help her regain her identity. Ruby is currently unmotivated and withdrawn from life, and she will benefit from less intensive daily schedule. She can be introduced to small, meaningful activities like recreational outlets to help give meaning to her life. And lastly, Ruby needs to be empowered with knowledge to make safer, informed choices moving forward. All recovery interventions should be done through shared decision making to ensure Ruby is the central author of her mental health recovery plan. And with this, I think there are a lot of evidence to suggest that Ruby can be referred to the mental health clinical nurse consultant for a thorough mental health assessment. I will now hand over to Bim to tell us what he thinks about Ruby's case.
Thank you, Sophia. Building on what you have said, Ruby has reported feeling not motivated, losing interest, and severe anxiety. She has also shown episodes of elevated mood, irritations, complex thinking, impulsive behavior, and increased alcohol and illegal drug use. These symptoms have greatly affected her relationships, jobs, and her areas. These symptoms also suggest Ruby might be experiencing complex mood disorders such as bipolar disorder, depression, or substance-induced mood disorder. As nurse, we have a responsibility to advocate for our patients by recognizing any deterioration in their mental health and making sure timely access to specialized care. Ruby has the right to receive person-centered, non-judgmental, respectful, and evidence-based care and to participate in her treatment decision. A comprehensive assessment by mental health CNC is crucial to identify any underlying cause and to make sure Ruby receives appropriate treatment. Current evidence also show that early specialist assessment and timely interventions are essential for people having mood disorder, which improves treatment outcomes, reduce suicidal risk, and help promote recovery. Current evidence also recommends comprehensive assessment of mood symptoms, substance use, medication as a part of coordinated care of multidisciplinary team. This evidence greatly supports referring Ruby to mental health CNC. What's your thoughts, Nora?
Thank you everyone for your valuable insights. Building on the assessments and intervention discussed so far, I'd like to conclude by focusing on the key nursing priorities for Ruby's care. The biggest concern in this case is that Ruby has disclosed experiencing suicidal thoughts. Although she has stated that she does not have any current plan to act on these thoughts, any expression of suicidal ideation must be taken seriously. Our first priority is ensuring her safety. Given her disclosure, a referral to the mental health clinic nurse consultant is essential so that a comprehensive mental health assessment can be completed. A key nursing intervention is developing a therapeutic relationship by building a trust and providing a safe, supportive environment where Ruby feels comfortable expressing her thoughts and emotions. In this case, Ruby only disclosed her suicidal thoughts after her mother left the room, suggesting that she might not feel yet comfortable sharing everything with her family. This highlights the importance of offering privacy, active listening, and non-judgmental communication. Ruby also presents with severe Ruby also presents with several risk factors that increase her vulnerability. This includes losing her job, withdrawing from her usual activities, experiencing sleep disturbance, using alcohol and other drugs, and feeling anxious and hopeless. Together, these factors may contribute to her declining mental health and increase her risk of self harm. At the same time, it is important to recognize her protective factors. Her flatmate noticed changes in her behavior and sought help, and her mother brought her to the hospital. This supportive relationship can play a significant role in her recovery and should be included in her ongoing care plan. It is my recommendation from a suicide young people specialist that Ruby needs to see a CNC for mental health assessment for the things I have discussed. I'd love to hear your thoughts on this team.
Thanks, team. I also believe Ruby needs to be referred for a mental health assessment with the clinical nurse consultant to help get support and be told all of the options to cope with the changes happening in her life. Using integrated care, we'll take a look at Ruby as a whole and use multiple support systems to assist with her recovery.
Yes, I agree that Ruby's presentation of mood changes and behavior changes require her to be seen by a mental health specialist.
Since she has symptoms which are consistent with significant mood disorder, which requires an urgent referral to mental health clinical nurse consultant. Thank you.